Hi there, New Zealand. My name is Amanda from LTR Medical. This is a demonstration about priming and filling and utilising the Accufuser as an appropriate pain management system. Your facility has decided to use the Accufuser to replace a couple of pain management systems that are being phased out. The Accufuser does not come as a whole kit, including catheters, carry bags, etc. It is a build-your-own kit. By that I mean the bulb of the size of your choice would need to be ordered, as would the carry bag and whatever catheter your surgeon or anaesthetist is choosing to use for the procedure. Today we'll be learning about the Accufuser itself. So the outer label of the Accufuser lets you know the basal flow rate and the size, the volume of the Accufuser, and also if there is a bolus associated with it. So as you can see on this label, it is 2 mil basal rate, a 5 mil bolus, and a 30-minute lockout. Once you do open the canister, you can see I have already partially filled this, and once again the details that are on the outer package are also on the device itself. So you can see that once again there. It has the volume of 300 mils, a basal rate of 2 mils, a bolus of 5 mils with a 30-minute lockout. It also has the lot number attached. Now the Accufuser does not need to be filled completely, but it does need to be filled at least to 50%. So with this being a 300 mil size, you must put in 150 mils, but anywhere from 150 mils to 300 mils is suitable. This is the filling port here with a one-way valve and a back check valve. From there, we have the remainder of the patient line. Then we have a clamp. Now I recommend not to clamp upon filling the device, and the reason for that is clamping can create a memory in the line. We then have our first filter. You'll notice on the filter it actually has an arrow, and that will be relevant in a moment when I talk about having the arrows pointing upwards during the filling process. Below the PCA button is another filter with an arrow. And last but not least is the distal end, which has a blue cap on it. Now this blue cap allows air to escape but not fluid. So please leave this in situ until such time as you are connecting it to the catheter. The button style itself is simply just a push button. There is a counter on it. So the counter goes from 1 to 24. So that may be relevant during some of your observations. I'm now going to use aseptic, non-touch technique, and I will ensure that my arrows are pointing towards the ceiling. Now, the reason that we do this is to ensure that we do not create an airlock. We need to basically push the fluid out first. We will then, fluid will follow, and this will enable there to have all the air escape first so that an airlock is not created. This does look quite awkward as I'm trying to do it in an environment on a computer, so it does look a little bit more cumbersome than what it would be in your institution. Please feel free to set up the lines or to tape them to something to make it more easier for you to fill. So right, we have both of our arrows pointing upwards, and here is our filling port here. This is purely just a Lua lock fitting. So as you can see, that is quite easy for me to inject, and at the same time, the balloon within the device is also filling. I'm going to aseptically place the cap back on. You would obviously have those arrows pointing up during the whole filling process. We can also now see that we have our first drop coming out of the end of the line. So that is now primed and ready to connect to our catheter. I believe in your institution that you are placing the catheter in theatre and the recovery staff will be filling the device, etc. There is a clear area down here for you to place your label to identify the medication that is within the device. And so just to summarise, basic things to remember. You do not need to clamp the line during filling. Please point the arrows of the filter towards the ceiling, and You do not need a filter on the catheter because we already have 2 inline filters in the Accufuser. If we had a third filter on the catheter, it would increase back pressure and could affect flow rate due to too much filtration. My contact details, should you need to contact me, are +61 for Australia, 431 879 422. Please don't hesitate to contact me if you have any further questions. Thank you.